Welcome back to our seasonal healing series. This is for the winter. We are working on the kidneys and bladder. And I just wanted to share today a little bit more about the herbs that we've been using, as well as some other things that can be used to support bladder health. So we've been using the kidney formula by Dr. Christopher, and this has been the main core formula we're using all through the winter. And that's to cleanse, detox, and strengthen and rebuild the kidneys and bladder system. So the herbs, though, that are in this, they have different properties. Juniper berries is a common herb used just for cleansing and stimulating the kidneys to release toxins. Parsley is a known and gentle diuretic herb, so that's going to help increase water flow through the kidneys and bladder. Marshmallow root is used to soothe the kidneys, and so this is helpful if there's any irritation, pain, inflammation, kidney stones. The marshmallow is going to just soothe that, help it so it won't be so irritating, and help things pass more easily. The golden seal root, that is put in there to help fight infection. Golden seal is a known antimicrobial, antibacterial herb, and so that is going to be great if there's any infection going on. Uva ursi is an antimicrobial as well. It also helps to tone and strengthen the kidneys and bladder so that they work better. Lobelia is one of those herbs that is kind of a do-all type of herb, and it's put in there to help the formula work better, along with the ginger. So ginger, along with cayenne and black pepper that is being used these days in a lot of formulas. These heating herbs are used as catalysts to help the formula work better, to get circulation moving so that the herbs work together and go where they're supposed to. And lobelia also assists in that. And it's also a nervine, meaning it helps with the nerve signals to the kidneys and bladder and helps to relax anything that may be tight and overly tense. So that is the list of ingredients in our kidney formula. And together it just is a great all-around formula for helping the health of the kidneys and bladder to just function better and detox and help things work more smoothly. So I also wanted to talk about some other formulas. So Dr. Christopher also has a formula called the bladder formula. This is more of an incontinence formula. So if there is any leakage, this is the formula for you. There's also a kids version, which is great with kids that still wet the bed. So it helps them to have stronger control over the bladder. It's got some of the similar herbs in it as the kidney formula, like the parsley, junipers, marshmallow, uva ursi, lobelia, and ginger. But then it also adds white pond lily, and that's for tonifying the bladder, so it strengthens it. The black cohosh is another nervine, so it's going to help with nerve signals from the brain to the bladder so that there is more awareness of when you need to go and being able to train your bladder to be able to hold on when you need to hold on. So, but overall, it's tonifying, cleansing, and supports that bladder health and strength. So, let's talk about a few things that can go wrong with the kidney bladder system. I have mentioned a few times that some of the deeper cleansing herbs are good when there are kidney stones. So kidney stones are often caused from calcium buildup in the kidneys. So that can happen when you're drinking hard water. So that's one cause. There's also foods with oxalates in them that causes those stones to form. So avoiding foods that have those high oxalates is also recommended if you have a tendency towards kidney stones, and then also those soda drinks are bad for that as well. So the hydrangea and the gravel roots are great and very specific to helping to dissolve those kidney stones. And distilled water is going to especially help to pull them out because it's an empty water, so it's going to attract minerals to itself and help to absorb, dilute, and pull those out. Another thing that we can talk about with the kidneys is urinary tract infections. That's something very common among women. And with women, those symptoms are usually very clear with burning, urination. You can have some pain and discomfort, and also mild fever symptoms. If it gets to the point of fever and sickness, definitely see a doctor. But I do want to just mention some things herbally that can help, as I do know a lot of people who go on several rounds of antibiotics and still end up with repeated UTIs. But just to be clear, UTIs can be very dangerous, and if they go untreated or undetected for a very long time, they can cause serious problems. And I will mention some personal situations with this. My father had a UTI that was undetected for several months, and it was not detected until he was already in sepsis, and that was damaging to his kidneys, which ended up creating kidney failure. So I am not a stranger to the fact that UTIs and kidney issues can be very serious. And so if you have any ideas that this could be a problem, I do recommend seeing a doctor quickly. But if you have seen a doctor and you've gone on rounds of antibiotics and they keep coming back, let's try something different. The Dr. Christopher's formula is going to help fight off infection with the golden seal and the uva ursi. And so that, along with cranberry. So this formula here has D-mannose and also cranberry and hibiscus and dandelion. The cranberry specifically prevents bacteria from adhering to the bladder walls. And so one thing they would teach us at school, in the School of Natural Healing, was to take a capsule of cranberry and 2 dropperfuls of the Dr. Christopher's kidney formula 3 times a day with a gallon of water, because you want to be able to really flush out those bacteria while you have the chance, while you're taking the cranberry, to prevent its adherence to the bladder walls. And then D-mannose specifically binds to specific bacteria like E. coli, so it also is flushed out and doesn't take up residence in your bladder. And then if that also doesn't work, or you continue to have infections there, homeopathics are an awesome and simple way to go. And I know some people who have only been helped by this specific homeopathic. With everything else they've tried for bladder infections or UTIs, this is called Cantharis 200C, and you can go at a 30C or a 200C. 200 is more of an acute or emergency type dose. Homeopathics are substances that in large doses before they're turned into homeopathics will create certain symptoms. So I believe Cantharis is Spanish flies. Sounds gross, but in large doses, that itself would create the symptoms of burning urination. And so they take that and they dilute it and dilute it and dilute it until what is left is just the energy signature of that substance. And what that does is goes in and informs the body to take care of that type of symptom in the body, which in large amounts it would create. In diluted amounts, it helps to trigger the body's healing mechanism to go and take care of this. And it works like a charm. So we don't all fully understand how these type of remedies work, but they are known by the FDA to be incredibly safe. Homeopathics are one of the safest type of natural remedies that you can take with no known side effects as far as the medical world is concerned. So those are a few herbal homeopathic remedies for your kidneys and bladder. I wanted to just share one last thing, and that is some reflexology points. Along with being a master herbalist, I also went to massage school, so I am a licensed massage therapist. And last week we talked about some points on the feet and ankles, which are meridian points for the kidneys and bladder. And those work along the acupuncture or meridian lines. Reflexology has to do with specific nerve signals. There is all of your nerve endings in your hands and in your feet. And so there has been research showing that those nerve signals are connected to different parts of the body, and you can access the nerves to that particular part of the body through your feet. And so there's lots of reflexology maps out there for the feet and for the hands. And there are different points that relate to the kidneys, or are the reflex point, or the nerve point that relates to the kidney and the bladder. And so the kidney point on the bottom of your feet is actually just below where that kidney meridian point is. So the kidney 1 point is up near the ball of the feet, right just below that. And then the reflexology point for the kidney is actually more in the center of the foot, just a little bit lower. And so you can press on that if it's a little bit sore. You just want to gently massage that for just 1 to 2 minutes a day, and get the nerve signals telling the kidneys that it needs to start paying attention and working out that tension that you feel there in the kidneys. There can even sometimes be little bits of knotted feelings under there, gravel. All of those things are just signs that the nerve flow and energy flow and circulation in that part of the body is not as good as it could be. So as you work it, then it's going to start getting those signals to the kidneys, triggering them to work better. The bladder point is down, it's kind of on the inside of the foot near the heel, or right above the heel. So there's a little point right where the heel meets the inside arch of the foot. So you just want to rub on that and see if that's sore. Sometimes something as simple as just being dehydrated and not drinking enough water will cause these points to be very sore. So increasing your water take can reduce the soreness, along with massaging these reflexology points. So there's just a few more tips for you during your kidney bladder care time during the winter, and we'll see you next time.